and welcome to the Viva Vulva podcast. I am your host, Dr. Cara Quant, and we have our lovely guest on the podcast today. Her name is Lily Wang. If you guys are not familiar with the podcast, this is my recurring guest. She is the CEOwner of MedAmour, which is an online sexual health awareness or sexual health company. And yes, we do episodes every once in a while talking about different things. We do giveaways, we do all types of fun stuff. So I thank you, Lily, for being on the podcast today again.
Thank you for having me.
And today we are going to talk all about Pap Smears. The month of September is Sexual Health Awareness Month. And so I was just thinking in terms of what content can I talk about, talking about sexual health awareness. And Pap Smears is one that is very common. I do a lot in my practice. But a lot of people either don't know about it, they're scared about it, they don't have a lot of information on it. And so we wanted to talk about, what are Pap smears? And so that is what today's episode is going to be about. And so what is a Pap smear? Well, a Pap smear is our way of doing cervical cancer screening. So the cervix, actually, I should show a picture. Since I have it behind me.
You just so happen to have that.
I just so happen to have this. The cervix, which is right here, is at the end of the vagina. That is where things like cervical cancer can live. And so the way that we screen a woman for cervical cancer is through the Pap smear. And it is something that we start at for women aged 21 to 65. But I know Lily has a little bit of information about the history of Pap smears, right?
Here's our history lesson. Thank you, Google.
History lesson, yeah.
Digging it up, where did Pap smears and Pap tests come from? It was founded by two physicians. One was a Romanian, Mr. Abel Babes. I'm probably pronouncing that wrong, sorry. And the other gentleman was a Greek physician named George Papanikolaou. It was just fun to say. Papanikolaou. So
it is kind of fun to say, Papanikolaou.
So for short, Pap. They decided to name it after him, and like you said, this was founded in 1927. It was also when the term guinea pigs kind of was invented. So guinea pigs is when they decided to guinea pig on the Pap smear test. So they did test it on guinea pigs first.
On guinea pigs, huh? Interesting. Huh.
Us women just being able to try the testing.
Yeah.
Of being able to, and I'll let you go into that about how to actually do the Pap smear test, but then it was definitely an easier version that was founded in the 1950s. So an important test. Thank you, Mr. Papanikolaou, into creating it for us.
Yes, and I mean, it has helped many women to either prevent them from having cervical cancer because they've detected it early and some of the cells were abnormal.
And by 80%, according to stats.
And we are back. So what I was saying was, so Pap smears are our way to detect cells that are on its way to cancer. And so it's a really good test. Throughout the world, it has been used. The information that I will share today and that we'll talk about today is information about the U.S. and about developed countries. So there's a lot of different guidelines out there. There's so many different societies that are out there determining which, like what guidelines to use and how often to do Pap smears. And so the information that I give is from ACOG. And so ACOG is an organization. They are the American College of obstetrician and gynecologists. So they're, the OBGYNs are the ones delivering babies and mainly doing these Pap smears. I, as an internal medicine doctor, also do Pap smears because I choose to do it. But these guidelines are coming from ACOG, but there are many other guidelines that are out there from like the American College of Cancer. So there's a lot of different ones that are out there, but I will specifically go over just the ACOG ones. So before we get into that, do you remember your first Pap smear, Lily?
You were making me dig into old memories, which obviously probably were detrimental, and you like bank them to not remember them.
Yeah.
I can definitely give you my thoughts and experiences on the past few. And I mean, what a terrifying experience if you're not educated on what you're walking into. We're in a vulnerable position, and in position
Literally, yeah, yeah.
The entire experience, it really depends on the environment that you're in, the chaperone that you're with, or if you're with a trusted parent or guardian or friend, and then if you trust your physician and the nurses that are all standard to be there in that space. But overall, like it is. What does everyone think about it?
Yeah.
Yeah.
I mean, yeah, I mean, I can say that I don't recall my first Pap smear, but I do remember that it wasn't very pleasant, just because it was uncomfortable. There was like some discomfort with just like scraping the cervix. And so, yeah, like I don't remember it being a very pleasant and like warm experience. But yes, every doctor is different. And because I've had different insurance plans and I've been a student for many, many years, I've gone to different providers. And there are some that are very good and, warm and are saying on details, everything that I see, everything that's going on, explaining the procedure to me. So yeah, every person is a little bit different on how they perform their Pap smears.
I've been fortunate. I mean, like, there's nothing that has been awful in my experience. Definitely the physicians with wonderful bedside manner and positivity and encouragement have been great. And you're right. It's if they communicate and tell you the step by steps that are happening during the process, it's relatively painless physically. I never experienced that pain through the cervix scraping. It's more of the like you laying there thinking, oh my gosh, like, and then you're apologizing. I was listening to an old podcast of ours and we were saying like, I'm so sorry, like I didn't shave, or like I just came from the gym, or whatever the reason, excuse. We have so much shame on our bodies, which we're trying to, like, that's the whole stigma that we're trying to break here through these podcasts and episodes and communicating and education, but that it's normal and we are there to go get an exam, and we should be thanking those physicians for taking a look at us and getting those exams done so that we can catch and have health preventative diseases.
Yes, yeah, and yes, I like that you say that about women saying that they're sorry about, either not shaving or it smelling a certain way, or them not shaving their legs, or even their like even painting their toes is what I've heard from patients, and I'm like, what? Like that is. I do not care about any of those things. This is what we're here to do. This is what's going to happen. Actually, so the next thing that I want to talk about is like what are the steps to a Pap smear, so that if you have never had a Pap smear, or if you have a Pap smear, these are kind of what I've experienced for myself, what I've experienced being a doctor doing a Pap smear. And I think that's very helpful. So I would say the first thing is you're probably already in the room. You're going to disrobe from the waist down. So you're taking your pants or your skirt or whatever it is and your underwear off. And generally a drape is put around you. You're given a drape to put around your legs. Then the doctor or the provider usually comes into the room. Sometimes you're already set up for it, meaning that your feet are already in the stirrups, and sometimes that is not the case. But what you have to do is you'll be on a table. You're going to lay down, and there's these stirrups or things that you put your feet into. I guess it's almost like horse stirrups, or the things that you put when you're on a saddle of a horse. So you're going to put your feet into these stirrups. And that basically allows for it for the provider to see directly your vulva. So your legs are essentially spread, and you are laying down. And so I think it's always helpful for the provider to tell you exactly what is going to happen. And also, if you are uncomfortable at all during any part of the process, that you can speak up and you can say that this is uncomfortable, that I don't want to do this anymore, that whatever things are on your mind, it's okay to speak during this time, especially if you're uncomfortable. So generally, I'll tell a patient, this is what I'm going to do. I'm going to place this speculum inside the vagina, and I'm going to look at your cervix. And so this, if you're looking at our YouTube video, this is a speculum. So it almost looks like a duck, is what I say.
Platypus duck.
Yeah. And it opens.
Like yours is plastic versus those metal ones, because they could be really cold when you're already in a vulnerable position, and it's like, oh, hello.
Yes. Yeah, so this is a plastic one. There are also metal ones, like Lily was saying. The plastic ones are generally a little bit warmer just because they're generally room temperature. The metal ones can be cold. There are certain establishment that have like speculum warmers, which is really cool. They also have like a lubricant warmer, which is really cool because lubricants generally put on this speculum to help it glide into the vagina more easily. The lubricant can also be cold, and the physician's fingers. So those all have something to do with your comfort. And you can always say, hey, your hands are cold, like, can you warm them up? Or the speculum is cold, can you warm it up? So it really, like, this is all about your comfort in doing this cervical cancer screening. So once this speculum is put inside of the vagina, the clicks are usually done to kind of open it up to better see the cervix. And then once the cervix is seen, then we go ahead and use it's a little brush. It kind of looks like a paintbrush, a little bit more specific, but it's just used to scrape very gently the cells on the cervix. And so those cells that are scraped off very gently on the cervix are going to be put into a little tube or little specimen cup that has some fluid in it. And that is going to be sent to the lab where they can test those cells and see if there's any cancer or any abnormal cells within the cells that were taken from the cervix. So those are the basic steps of a Pap smear.
Perfect.
Those are the basic steps, yeah.
Those are all true. I was going to say the part that is hard to explain and that's missing is the emotional part. And that's where everyone is like stressed out and going through different experiences of how they would enjoy or not enjoy a Pap exam.
Yeah. There are some, I mean, just because I was a medical student, and as a medical student, we're generally following a doctor around and observing how they're doing different procedures. And so there's been times where I've seen Pap smears done really quickly because these are very experienced doctors. They may not be as gentle with the patient. And there's other providers that, take their time. They speak it out with them. So like I say, it's always, you're being you're being examined. It is up to you to speak up if there's any discomfort that you're experiencing. But yes, there are some psychological aspects to a Pap smear. I mean, it could be really cold in the room. Like, comfort is a big thing.
Right.
Yeah.
Anybody is mentally in that moment.
Yeah. And so who do we generally do Pap smears on? Well, so according to the ACOG guidelines, and actually most guidelines out there within the U.S., we test people ages 21 to 65. The reason why, so we're testing it for cervical cancer, and the reason why people can get cervical cancer is generally from HPV, the human papilloma virus. And so HPV can cause cells within the cervix to become abnormal and can eventually lead to cervical cancer. Well, so we test individuals 21 to 65. And the guidelines are ages 21 to 29. We're testing you every 3 years. And the reason why it's every 3 years instead of yearly is because they've done a lot of research saying that you don't need to have a Pap smear every year, like we used to do when I was in my 20s. That used to be the guideline, but guidelines have changed.
You know why?
What'd you say?
You know why?
Because they've done research, and research shows that it doesn't need to be done as regularly as we had done it in the past. Just because from year to year, the cells don't change that quickly in a immune competent, meaning a person that has a really good immune system between the ages of 21 and 29. Yeah. Mm-hmm. And so it's generally every 3 years, and you're only getting a Pap smear, which is the scraping of the cells of the cervix. Once you get to age 30, it's a little bit different. And so when you're 30 to 65, we're testing more specifically for HPV. So it's called co-testing, where you're testing the cervical cells, and you're also testing for this human papilloma virus. And we're generally checking the more high risk strains. So the strains of the virus that are more likely to cause cervical cancer. And those are strains 16 and 18. There's a lot more different strains out there. And it's testing these more specific strains, but 16 and 18, I remember in medical school as one of the most common ones that cause cervical cancer. So, and that is done from age 30 and above. That's done every 3 to 5 years, and it kind of depends on your provider and yourself on talking about how often it should be done. But it's generally 3 to 5 years that you're doing a Pap smear with HPV co-testing. And so at age 65, there's been research to show that we don't need to do cervical cancer screening any longer after that, unless there are different cases. So somebody has HIV or some type of cancer that puts their body at risk of having other types of cancers like cervical cancer. So there's other reasons why someone can be tested beyond 65, or if someone has had a hysterectomy and their cervix has been removed. So a hysterectomy is removing your uterus, and your cervix is actually a part of your uterus. And so if they remove your uterus with the cervix, then you don't need to be tested, even if you are 50 or 55 years old. So those are our general guidelines from ACOG for testing or doing Pap smears.
Whew, thank
you. That's a handful. But I actually did want to talk about chaperones, because that's another big thing and a big topic that is happening or being talked about now, especially within the medical communities. But the Me Too movement, that's like a huge thing. And a lot of different industries have been affected by, women speaking up for, or just people speaking up for sexual abuse and assault. And the medical community is not adverse to it. There are many people, OBGYNs, other providers that have touched women inappropriately because there was not a chaperone kind of within the room. So the big things.
Chaperone is an addition to the nurse or another physician in the room?
No, so a chaperone it's the provider, whoever is doing the Pap smear, and somebody else kind of watching over the procedure happen. Yeah, to make sure that nothing goes wrong. Yes.
I would think
there's no inappropriate touching or anything like that going on.
I didn't know if that was like a new standard, but otherwise In my entire life since I was 20 taking Pap smears, there's always been an additional chaperone there. So
Mm,
the nurse assisting the doctor.
yeah. And that is generally the case. There's some, busy practices where the nurse can't be available, but that is the case now, or at least, me being a new physician, chaperone, and actually in the past, chaperones haven't always been there. They've sometimes been in the room, but generally speaking, and there's no real hard guidelines for it. But if it's an opposite sex, so if it's a male, if it's a male provider doing a pap smear on a female patient, then a chaperone should be in the room. Or even if it's a female provider doing a pap smear on a female patient, you can request a chaperone to be in the room. So, but those are all very helpful. And again, as a patient, you definitely have rights, and you can definitely speak up for your comfort level on what you want.
Good advice.
Yes. Because yes, the Me Too movement it's a big deal. There's been a lot of women who have been affected, psychologically, physically, mentally, by people touching them inappropriately. And so, this Pap smear is good for testing and for preventing cervical cancer, but it should be done in a very respectful way. Yeah. So during or at the end of the Pap smear, so once the swab has been done, once the speculum has been removed, well, maybe not quite then. There are other things that can happen during a Pap smear. So we can also test for STDs, which is another thing. So we can test for gonorrhea and chlamydia in a Pap smear. Yeah, we can do a swab also for those two things. And you can always ask for a test, an STD test.
I have a question. Those who can see me using my hand. How many inches is the speculum open in the vaginal canal? Since we don't see it, I was just curious. Do you have like a guess average?
How large, like how wide does this go? It actually depends on a woman's cervix. So it really, yeah, the cervix can be in different positions. So just more basically, it can be like really high or really low. And so or it can actually be more anterior, kind of close to the opening. And so it's determining where it is, and that you adjusting the height of it can allow for the cervix to kind of come into view. So I don't know exactly how wide it opens, but it doesn't actually have to open that wide for us to actually see the cervix.
Okay, thanks.
Yes.
Like watching you open that speculum, I'm like, that's kind of wide.
Yes, it can open pretty wide. But there are also women who have had children, women who have had many children. It can be a little bit more lax within the vaginal canal, and so the heights can help with getting the cervix more into place. Yeah.
Thank you.
But yeah, the Pap smear is also a time to talk with your provider about anything else that is going on. If you want to have STD testing, like I said, or if you have any other issues, like, hey, I'm having problems with pain with sex, or I'm having problems with orgasm, or I'm having problems with just like receiving pleasure. You can talk with your provider if you feel comfortable, and you can bring this up to them. Because sometimes, even though it should be the case, sometimes your provider either doesn't have the time to bring it up, or doesn't know how to bring it up, or they just forget to bring it up. So whatever is on your mind when it comes to your vulva and your vagina is helpful to bring up at that time.
So for those listening or watching, if you're not comfortable talking to your physician, you can reach out to Dr. Cara or me.
Yes. And the portals are either DMing through Viva La Vulva LA or emailing at info@vivalavulvala.org. So yeah, those are the portals so far, or MedAmour, DMing or emailing, correct? Yes.
Right.
Yes. So yeah, I mean that's generally what I wanted to bring up and talk about Pap smears, because I think when I was younger, when I was a teenager, it was elusive to me. I was like, a Pap smear. It just sounded really scary and crazy, and so it isn't as bad as some people may say it is, or maybe they've had a bad experience with it. So everyone's experience can be a little different.
The only thing I would add to your process and the steps of the Pap smear exam, it was all true and accurate, but instead of being undressed waist down, what's unfair is that we're also undressed the top up sometimes, because that's also when we're getting our breast exam and
Yeah.
this annual exam. So you're completely naked in this like paper thing that we don't know what it really is, vest and a cover. So then you're laying on that table with the AC blowing in the stirrups. So I'm like, "Hi, doctor. Nice to see you. You get to be fully dressed, and I'm naked." But
Yeah. Yeah. Yes. And so yes, you are, as a patient, put in these vulnerable situations. And so that's the reason why I advocate for speaking up. If you are uncomfortable, I mean, maybe sometimes they can't adjust the temperature in the room, or sometimes they can't, like adjust the temperature of the speculum. But you can always just speak up for like what you feel discomfort in.
so as like not as uncomfortable it is, ladies, go make sure you do your annual exams, your wellness exams, your breast exams, as well as your Pap smears, because statistics show that it does catch the cervical cancer and preventative processes for you.
Yeah. Yes, and there's a lot of preventative processes that are out there, and the Pap smear is one of them. So, yeah, it's very important, and there's a lot of women that even will not do or not want to do the Pap smears. Often I will talk with them about, like, just the reasoning behind it. But maybe listening to this podcast, you'll have a little bit of a different perspective about cervical cancer screening with the Pap smear. Yes. With that being said, it was a pretty short episode. I don't know if you wanted to add anything else, Lily.
I'll say if anyone who's having like heebie-jeebies going to get their Pap smear exam, maybe listening to some music, like putting on your headphones, have a little something in your hands if you're like someone who is very tactic and wants to hold something to fidget with, or chew your favorite gum and think good thoughts.
Yeah. You can also take some. Well, I won't add that, but yeah, there are different things that you can do. Maybe if you have a partner that you want to bring into the room. I know during COVID, a lot of people, we've prevented, visitors or guests to come into the rooms with patients. But after COVID, having somebody in the room to hold your hand, that can also be helpful.
Since you mentioned COVID, what do women do who've missed their annual exam during these past summer months? I might be one of them. Are we supposed to reschedule and do that now, or just kind of wait till next year?
So again, well, in terms of annual, so there are other things that can be done annually, like the breast exam, or if you want to have like STD testing. But Pap smears again are 3 to 5 years. So if you have missed that, you can always talk with your OBGYN or your primary care doctor about scheduling it. I know that a lot of places have gone virtual, and so you're having a lot more visits with your doctors, either video calls or just telephone calls, which a lot of things can be handled that way, but Pap smears obviously can't be handled that way. So just talk with your doctor, your provider, because a lot of people are still seeing patients even at a limited capacity during this time.
Okay, well, thank you, Dr. Cara.
Yes. So, with that being said, thank you, Lily, for being on the podcast and giving some information and experience about the Pap smear. I hope you guys enjoyed this episode. If you did, hit subscribe to the podcast. Let your friends and family know about this podcast being out there. And just, again, the goal is to empower female sexual health through different art forms, this podcast being one of them, and just getting to know the vulva inside and out. So I thank you for listening, and we'll talk to you next time. Bye.